Core motivation for why we launched the BC PharmaCare Minor Ailments and Contraception Service was to really better utilize the health human resources that we have here in BC. We know that pharmacists can do a lot more than the traditional roles that they'd assumed before.
I'm one of the pharmacists here today.
We knew that patients were already seeing their pharmacists for a lot of their health questions, and we felt that, it was time to expand their scope so they can do more for their patients.
Good morning. So we want to implement minor ailments for pharmacists. So basically we're given a policy. The working group was really about figuring out what does that look like? What minor ailments were those? What law regulations needed to be changed to make that happen? Which groups needed to be involved in order to make that happen? The College of Pharmacists, the ministry, education institutes. And then it was really about what are all the pieces that need to happen in order to operationalize this?
So the first change really was for government to look at the pharmacist regulation under the Health Professions Act, to really look at their scope of practice and expand that scope of practice. So that is within government's domain, and the college in partnership work collaboratively with them to inform what that might look like. The college then responsibility is to look at, our mandate is public protection, so we developed what we called standards, limits, and conditions, which is the standards of practice. It was done very quickly, but enabled us to be able to deliver on this safely.
When we were designing this program, we wanted to make sure that it works in all parts of our province, whether it be more urban or whether it be, less urban, like somewhere like in Tofino, because we knew that people in more rural and remote areas had that lower access to care.
For a minor ailment, I heard you.
Since June 1st, 2023, we had more than 300,000 patients access this service. We had more than 400,000 assessments from pharmacists, and over 92% of the pharmacies, that's 1,400 pharmacies, are participating in this program.
With these types of projects, it's easy to kind of downplay the level of complexity and the many different things that need to happen in order to make these things a success. The team here was the only way that we were going to get that level of success.
I've been doing public policy for greater than 25 years, and I can tell you that I've never seen the partners working together to accomplish a common goal as we did here in a very quick time frame. Although it's small incremental steps, these statistics and information is really showing a difference for the people of British Columbia.